Hello, everybody. My name is Nawabi, and today I'm going to be discussing one of our ongoing projects, titled Complications of External Ventricular Drain Misplacement, a Systematic Review and Meta-Analysis. We have nothing to disclose. To provide you with a little bit of background, external ventricular drains, or EVDs, are devices that are commonly utilized in neurosurgery to relieve elevated intracranial pressure. EVD placement is one of the most common neurosurgical techniques, as they have multiple indications, ranging from hydrocephalus to traumatic brain injury. The image on this slide shows the standard EVD placement site for these devices, known as Coacher's point. The tip of the EVD is positioned in the anterior horn of the lateral ventricle, such that it can then drain excess accumulated cerebrospinal fluid. Coacher's point is located approximately 11 centimeters posterior to the nasion and 2 to 3 centimeters lateral to the midline, as you can see from the figure. EVDs are often placed at the bedside without imaging guidance, oftentimes by lower-level residents and trainees, and often emergently. While their ability to be placed at the bedside is an advantage in some respects, complications associated with this blinded placement, including tract hemorrhage, are more common than one might expect. These complications are exacerbated by the need for multiple attempts to properly place the catheter in an optimal position, which we have noted from our clinical experience to be a common problem. In this study, we aim to systematically review occurrences of EVD misplacement by determining how many pass attempts are required to successfully place an EVD into the ventricles. After defining our study's inclusion and exclusion criteria, a systematic search was conducted using PubMed, Embase, and Web of Science for studies pertaining to EVD placement and complications associated with multiple catheter pass attempts. This literature search returned 2,558 studies, and we are currently in the process of screening them for inclusion. Studies will be included if they report our primary outcome variable, being the total number of pass attempts required to successfully place an EVD. We will also look to collect secondary outcome measures, such as complication rates and the number of passes that are successful in the first attempt when available. Afterwards, we will conduct a stratified exploratory data analysis to explore commonalities among data and identify variables that may influence results, such as placement setting and physician training level. Collected data will be pooled across studies using the random effects model via the Derzemonian and layered approach, and heterogeneity among studies will be tested through use of the Cochrane Q test and quantified with the I-squared index. Sources of heterogeneity will be explored through subgroup analysis and meta-regression, and for outcomes that are reported in more than 10 studies, publication bias will be assessed through the funnel plot and the Peg and Egger statistical tests. As previously noted, our study is ongoing, and we are not able to report final results at this time. However, for our primary outcome measures, we expect to show that freehand insertion of EVDs often requires more than one pass attempt. Preliminarily, there are studies that support this trend. For example, a study by Phillips and others in 2014 reports that 28% of EVD placements at their institution over a 2-year period required multiple pass attempts. For our secondary outcome measures, we anticipate finding a correlation between number of pass attempts and complication rates. There are also studies supporting this trend, such as the report by Miller and others in 2017, which found that each additional pass of the catheter was associated with a 306% increase in the odds of a hemorrhage occurrence. We intend for this systematic review and meta-analysis to report the average number of pass attempts needed to successfully place an EVD. Based on the clinical experience of the authors, we expect to show that EVD placement is often associated with multiple catheter pass attempts, and that multiple pass attempts are associated with an increased risk of complications. Completing this study will help quantify the risk profile of this procedure and will shed light on areas for advancement in technique, training, and technology. Given the frequency of EVD placements in neurosurgical practice, it is critical that we better understand the current risk profile associated with it. Thank you all for your time.